Good afternoon and welcome to the May 7th Community Update. My name is Stacy Wood and I'm a Public Information Officer in the Emergency Operations Center overseeing the Joint Information Center. This community update is available in Spanish on the Buncombe County Health and Human Services Facebook page at BCHHS. Before we get started, to allay the concerns of some of our viewers, I want to confirm for you all here and now with this measuring tape that we are, in fact, 6 feet away from our American Sign Language interpreter, Regina. Also, for those of you who wonder why we are speaking slowly, we do this so that we are able to effectively communicate important health and safety information to a variety of audiences, and it also helps to ensure that our American Sign Language interpreters and simultaneous Spanish interpreters are also able to effectively and accurately communicate this information. Today's community updates come from Dr. Mullendorf, Buncombe County Medical Director and Interim Public Health Director, Brownie Newman, Chair of the Buncombe County Board of Commissioners, Esther Mannheimer, Mayor of Asheville, Fletcher Tove, Buncombe County Public Health Preparedness Director, and David Thompson, Student Services Director for Buncombe County Schools. And we will get started with an update from Dr. Mullendorf.
Good afternoon. As of noon today, there have been 87 lab-confirmed cases of COVID-19 in Buncombe County residents and 4 COVID-19 associated deaths. 30% of these lab-confirmed cases have been individuals who identify as Latinx. We continue to work with community partners to ensure that information about COVID-19 and how to prevent infection is shared with all populations in our county. At this time, over 2,900 tests have been done on Buncombe County residents since the start of the outbreak. We are still waiting on the 100-county plan that the state is creating related to testing across the state. People who are experiencing symptoms of COVID-19 should be tested. Again, while our message weeks ago was to stay home and isolate yourselves if you have symptoms, mild symptoms of COVID-19, the message now is we want you to seek testing. Symptoms of COVID-19 may include cough, shortness of breath or difficulty breathing, fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. Residents of Buncombe County are encouraged to use the county's COVID-19 self-checker to determine whether or not they should be tested for COVID-19. Since its launch a week ago, there have been approximately 1,300 visits to the website. A total of 370 Buncombe County residents have completed the self-checker. 40 have reported severe COVID-19 symptoms and were referred to call 911. 138 reported mild symptoms and were instructed to contact their healthcare provider or call our hotline to get information on how to get tested. We continue to follow up with 127 residents with mild or severe symptoms who opted into a daily check-in. And of those, about 26 individuals reported being able to get tested, and 1 reported resolution of their symptoms. We continue to follow up with all individuals who opt in to the daily check-in and connect them with the level of care that they need. Buncombe County and Western North Carolina Community Health Services will partner to offer community-based COVID-19 testing beginning next week for individuals who are experiencing symptoms of COVID-19. Buncombe County Emergency Operations Center's Rapid Response and Recovery Equity Action Team is identifying the testing site locations based on data and community input. Testing at these community-based sites is available to Buncombe County residents regardless of race, ethnicity, income, gender, immigration status, religion, or ability to pay. Testing will be available to both the insured and the uninsured with no out-of-pocket costs. Those who have health insurance should bring their insurance information with them to the testing sites. Specific information about the testing sites will be announced next week. We want to remind everybody that testing has expanded in our county. We know that many primary care providers, including pediatricians, family doctors, and internists, are able to conduct testing on their patients. Mayheck Family Health Center at Biltmore, Mercy Urgent Care's 4 locations in Buncombe County, and Range Urgent Care have all expanded testing access for symptomatic individuals. If you have questions about COVID-19 testing in Buncombe County, please visit buncombeready.org or call the Ready team at 828-419-0095, Monday through Friday, 8 a.m. to 5:30 p.m. We stand ready to serve our community during this COVID-19 pandemic. And as you've heard earlier this week from the governor, and as you'll hear later in this briefing, restrictions on activities will be lifted in our area and across the state tomorrow evening. And I just want everybody to understand what that means and what will be required of us. As you've heard, we are not going back to what life was like prior to COVID-19. We need to continue to limit non-essential travel outside our homes. We need to stay home if we are sick. We need to keep that 6 feet distance from others who we do not live with. We need to be wearing face coverings over our noses and mouths when we are outside of our homes in public. We need to continue to wash our hands or use hand sanitizer. COVID-19 is still here. We are all still at risk of infection or of spreading the illness to others. We want to keep our community safe, keep people out of the hospital, and keep people from dying. So it is critically important that we continue to follow this guidance. Thank you and stay safe. And I'll now turn it over to Chair Newman.
Thank you, Dr. Mullendorf. Good afternoon. Before I begin, I'd like to acknowledge some of the other elected officials and county officials that are with us today. Commissioners Joe Belcher and Anthony Penland. Sheriff Quentin Miller is here today, along with the mayor of Asheville, Esther Mannheimer, who we'll hear from in a moment, and Avril Pender, the county manager, is also here. As chairman of the county commission, I'm going to execute a revised local COVID-19 emergency order for Buncombe County today to generally align with the statewide plan adopted earlier this week by Governor Cooper for a phased reopening of community and economic activities. One of the lessons that we have learned over the past 2 months is that communities that took early action to reduce the spread of COVID-19 have seen lower levels of transmission and resulting illness and fatalities. Currently, of the 10 largest counties in North Carolina, Buncombe County has the lowest rate of documented COVID-19 cases and one of the lowest rates of hospitalization and fatalities. We believe the fact that Buncombe County was an early adopter of an emergency order to defer non-essential gatherings has made a positive difference. The active cooperation from our residents, businesses, and organizations has been critical to our community's success. As more business sectors begin to reopen, we want to keep the rate of COVID-19 low. The reality is that until there is a vaccine, which is not expected this year, we have to use new safety protocols so that we can restore more of our economy and community activities while keeping COVID-19 at levels that we can manage. Our success going forward will continue to rely on a united community effort. With phase 1 of the reopening process beginning tomorrow, the county and all our municipalities will be implementing the same state policies in regard to the business sectors that are open and the safety protocols that need to be followed. The one sector where Buncombe County and our municipal partners in Buncombe County will continue to set specific limits on reopening is for leisure tourism. Due to the popularity of Asheville as a tourist destination with up to 10 million visitors in a typical year, and the fact that many areas of the country, including neighboring states, have much more extensive spread of COVID-19, hotels, inns, and short-term rentals in the county will only be open to residents of Western North Carolina, employees who are doing work for an essential business, or in other specific situations where a hotel operator is partnering with local government on local quarantine efforts. Leisure tourism for people who live outside of Western North Carolina will not be allowed during phase 1. We look forward to being able to invite visitors back to our mountains and Asheville, but we need to do so in a careful, incremental way. We continue to appreciate the cooperation with all of the municipalities in Buncombe County. Asheville Mayor Esther Mannheimer is with us today and would like to share a few comments.
Thank you, Chairman Newman. As we move into phase 1 and closely align with the governor's plan to reopen, the city continues to work collaboratively with Buncombe County to develop the best way forward. We know the pandemic continues to have a profound effect on our daily lives and our economy. We are committed to reopening in a way that is safe and works to restore our economy. To that end, we ask that during phase 1, which is anticipated to last 2 to 3 weeks from this Friday, you continue to stay home as much as possible and follow the guidelines laid out by the governor. Following the 3 W's can help us remember to stay healthy. 1, wear a face mask in public. 2, wait to allow for at least 6 feet of social distancing. And 3, wash your hands regularly. As we begin to reopen, it is more important than ever to follow these public health guidelines. I agree with Chairman Newman that the success of these efforts will depend on a united community effort. Our continued collaboration is critical to ensuring that the reopening process does not undo any of the progress we've made to date. Without collaboration and cooperation, we will not be able to continue to slow the spread and move into phase 2 of the reopening plan. We have seen positive impacts our consistent efforts have had over the last several weeks. We would like to continue that trajectory during phase 1. Finally, this week is Public Service Recognition Week. So I would like to extend a special thank you to all our public service servants in Asheville and Buncombe County. Special shout out to our city manager, Deborah Campbell, who's right here with us today. It's also Teacher Appreciation Week. A big shout out to our teachers. From my house, I can see and hear the hard work you are doing to stay connected to students and to continuing to teach under these unprecedented circumstances. And also, it's Nurses Appreciation Week. We always appreciate our nurses, but this pandemic has certainly highlighted the sacrifice you make to keep us all healthy and safe. Thank you for all you do. And now we'll hear from Chairman Newman again to sign the order.
Thank you, Mayor Mannheimer. And one clarification before I sign the order. The town of Weaverville did withdraw from the county's previous local order, but with phase 1 beginning tomorrow, all municipalities and Buncombe County will be following the same state rules as it relates to all business sectors. So with the beginning of phase 1, we are all implementing the same policies. And the town of Weaverville has agreed to join the rest of Buncombe County in our policies as it relates to leisure tourism. So for those reasons, going forward in phase 1, all municipalities and Buncombe County are following the same set of policies. I am now going to sign the local order. And I would now like to invite Fletcher Tove, the Public Health Emergency Preparedness Director for Buncombe County, to share remarks about the county's policies and strategies for phase 1.
Thank you, Chairman Newman. Good afternoon. I'm Fletcher Tove, Buncombe County Emergency Preparedness Director. Today, I'll be walking everyone through our new Stay Home, Stay Safe order. This order aligns us with Governor Cooper's Executive Order number 138, with the sole exception of a continued restriction on leisure travel bookings, which I will go into detail on in a moment. We will be adopting the governor's order together with his FAQ document, his frequently asked questions, specific to Order 138. This order moves Buncombe County into phase 1 of easing certain COVID-19 restrictions to help revive the economy while protecting the public health. It eases restrictions on travel, business operations, and mass gatherings. The order goes into effect at 5 p.m. tomorrow, Friday, May 8th, and remains in place through 5 p.m. on Friday, May 22nd. As our stay-at-home order remains in effect, everyone should still stay home as much as possible. but the variety of reasons people are allowed to leave their homes has been expanded. If you do leave home, make sure you know and practice the 3 W's that Mayor Manheimer expressed. Wear a cloth face covering, especially if you'll be in a situation where you can't maintain distance from others. Wait 6 feet apart. Avoid close contact with others, especially for prolonged periods. And wash your hands using hand sanitizer or soap and water with increased frequency. This guidance has not changed. So what is different about phase 1? Phase 1 eliminates the distinction between essential and non-essential business. So we're moving past the vocabulary of essential and non-essential. It allows most retail businesses, with several exceptions, that can comply with specific requirements to open at 50% capacity. And I'll get into those exceptions and specific requirements in a moment. It allows people to leave their home for commercial travel, broader business purposes, and services. So now you can go to stores that were previously closed as non-essential under previous iterations of the order. It encourages state, county, and city parks and trails that were closed to open. It specifically allows people to gather outdoors while following the recommendations to promote physical distancing and reduce transmission with up to 10 people at a gathering. And it opens childcare for working families. It also encourages everyone to wear a cloth face covering when outside the home in order to protect others, particularly in places where you can't consistently maintain 6 feet from others. So what businesses must remain closed during phase 1? Restaurants remain closed for dine-in service, but can continue to stay open and provide meals through drive-through, takeout, and delivery. Personal care and grooming businesses, including barbershops, hair and beauty salons, nail salons, remain closed. Basically, if your service delivery requires you to be in close contact with someone, you must remain closed. Health clubs, fitness centers, gyms, and other indoor exercise facilities remain closed, to include yoga studios, martial arts facilities, indoor trampoline and rock climbing facilities. And entertainment facilities also remain closed, including performance venues, movie theaters, bowling alleys, and indoor and outdoor pools. So phase 1 opens up retail business, but there are requirements that these retail businesses must follow. They must direct customers and staff to stay at least 6 feet apart, except at points of sales, if applicable. It limits occupancy to not more than 50% of the stated fire capacity and ensures that social distancing of 6 feet apart is possible. They must mark 6 feet of spacing in lines at point of sale and other high traffic areas. They must perform frequent and routine environmental cleaning and disinfection of high touch areas and surfaces with EPA approved disinfectants. They have to provide, whenever available, hand sanitizer stations or soap and water and hand drying materials available at sinks. They must conduct daily symptom screenings of employees before they enter the workplace and immediately send symptomatic workers home. Buncombe County has developed a screening tool that is available for all businesses, which I will share later. They must have a plan in place to immediately isolate any employee at work who develops symptoms. And they must post signage at main entrances to remind people about their recommendations to promote social distancing and reduce transmission. And we have also developed resources for that, which I will share momentarily. So now let's talk about the one area where we continue to be more restrictive than the state. Buncombe County continues to restrict leisure travel bookings from outside Western North Carolina. Lodging providers can now book rooms for residents of the 828 area code for leisure travel. They can also start taking future leisure bookings starting May 22nd from outside the 828 area code. But they must assume the risk that either state or local guidance may change, be extended, or modified on those restrictions on leisure travel. Occupancy for lodging is also limited to 50%. This leisure booking restriction and those previous restrictions apply to all lodgings, including hotels, motels, bed and breakfasts, hostels, homestays, and campgrounds. Other notable parts of the order are that funerals may be held either indoors or outdoors and may include up to 50 persons, but they must follow physical distancing guidance and other public health measures to reduce transmission. Worship services may now include more than 10 people as long as that service is conducted outdoors. And again, attendance must follow physical distancing guidance and other measures to reduce transmission. So for local retail shops that will be reopening, we have put together some resources for these businesses that can be found at buncombeready.org. These resources, which you should now be viewing, include signage that businesses owners can post on their storefronts to comply with the governor's orders. This information on this signage will set expectations for what patrons need to do as they come and enter the business. And they also inform the public of what measures are being taken by the business to ensure their safety. We have also put together an employee screening tool and screening log for any business that would like to use it. The daily screening of employees is a best practice for all employers, but it is specifically mandated by the governor's order for retail businesses that reopen. This concludes my review of the new Stay Home, Stay Safe order, bringing us into phase one. But I would like to leave you with one final thought. Despite the progress we have made in our relatively low case count in Buncombe County, COVID-19 is still a highly contagious virus, and we are still in the midst of a global pandemic. It takes all of us working together, following public health guidance to safeguard our communities. Buncombe County's response continues to be driven by data, science, and facts. Let's be safe, let's be smart, and let's take this step by step. Thank you. I'll now turn it over to David Thompson, Student Services Director with Buncombe County Schools.
Thank you. Yes, I am David Thompson. I'm Director of Student Services for Buncombe County Schools. I'd like to also acknowledge that May is Mental Health Awareness Month, and today is Mental Health Awareness Day. So as such, I'd like to offer some comments about what it means to be resilient during this time. During this pandemic response and stay-at-home period, everyone has experienced stress due to the tremendous changes and shifts in responsibilities, employment, childcare, remote education, and the overall effects of feeling isolated from social contact. You must recognize that whatever your own response has been, whether that's feeling down or feeling frustrated, angry, or just shutting down, they're all normal responses, both physically and emotionally. Our community has committed itself across all sectors to moving toward the understanding of resilience, which is the ability to handle those stressors of daily life. One's response to this current crisis depends on the ability to balance those stressors with the parts of our lives that help support us during this time. So imagine a balance scale with hard things on one side and good things on the other. We all strive to have balance between those things, or even preferably to have the scale tipped toward the good things. That's what resilience means. But more likely, our lives follow a pattern where our responses fall somewhere within a resilient zone. Whether within a day or from one day to another, our reaction to stress and difficult things falls into a range. We all react and get a bit anxious or angry or frustrated or sad, but we don't experience that for a long time and often find resources like other people to vent to or to talk with that helps us to return to a more relaxed place. But our bodies help us notice when we experience that kind of stress. Our heart rate increases, our breathing becomes shallow, tension increases in our muscles, or we might even have an upset stomach. So just imagine that during this long, stressful event like we're currently in, that sometimes our bodies get stuck on that high level. It's like driving and you have the gas pedal stuck, and your mind races with emotions and you know you have to react, but you just can't do it. Or sometimes you even react with things that may not be helpful or productive. And then at other times, your foot gets stuck on that brake pedal and you know you need to do something, but you just can't. During the pandemic, it's normal, actually, to have both of those reactions at the same time. The gas pedal's stuck, we know we need to react, or react quickly with anger, worry, or fear. And at the same time, we feel the brake pedal response. I don't know what to do, or just can't do anything right now. It's important to know that your response to that stress is normal. But there is hope and ways to feel better and more resilient. For your children, please reassure them to look for the helpers around them. If they talk about COVID-19, let them know that there are a lot of people who are working to make everyone safer and better able to deal with this virus. Let them know that there are teachers and counselors and family members who are focused on their safety and health and are making decisions to protect them and help them feel safe. There are even a lot of people right now who are planning what a return to school will look like and feel like for everyone so that we all feel safe and be able to learn. Giving this kind of reassurance goes a long way to guiding our children into positive thinking. I'd like to suggest a couple of very simple things that anyone can do at any time. Number one is simply notice where in your body your stress or anxiety is showing up. Sometimes it could be stiff, achy muscles or a faster heartbeat or shallow breath. It could even be a physical pain or discomfort in some part of your body. When you notice this, try to use some kind of physical activity to calm your body's response. It could be a walk outside in nature. It could simply be moving around your house. It could be pushing on a wall or finding objects that are heavy to hold and feel that weight in your body or the texture of what you're holding. And then take several breaths to reduce your heart rate. After you do these things, just take a minute to notice how your body's reactions change. Your breathing becomes more regular, your heart rate slows, and your muscles relax. This can be done multiple times during the day to notice and then shift to a more regulated state. The second thing I would like to recommend is gratitude. Gratitude for things or people or that's anything that is special to us is an excellent way to shift our thoughts into a positive place. Almost everyone has something that they are thankful for. Or for the everyday things or people that you are thankful to have in your lives. It doesn't have to be something big or something very different. When you feel that gratitude, also take a minute to notice that change in your body's reaction, just like with the physical activity. It is difficult to feel as anxious as before when we focus on gratitude. Remember, it's those good things that we have that help us to be more resilient. Finally, if you're constantly feeling overwhelmed or depressed to the point that it's interfering with your normal activities, know that there is help available to build resiliency skill or to access mental health support and services. On your screen, you should see the Hope for NC helpline that is available 24 hours a day, 7 days a week. This line will connect you with local mental health providers who are specifically trained to assist with immediate support while connecting you to continuing mental health services. Also know that whether you require basic needs for you or your family or mental health support, there's assistance through our local 211 support to link you to the correct resources. Thank you, and please be aware of the mental health that is all around you that everyone has. We all have mental health. Thank you.
Before we leave you today, I've been asked to make an announcement on behalf of United Way of Asheville and Buncombe County. They report a need for toilet paper, non-perishable pantry items, and hand sanitizer. And they ask that people or businesses with the ability to provide these items visit handsonasheville.org and click on the COVID-19 page. And once you're there, you'll click on the button that says, I'll give in-kind donations. Please be safe this weekend. We will provide the next update on Monday at 2:30 p.m.